Coronary bypass surgery is the gold standard treatment for patients with severe coronary artery disease. Venous vein grafts are the most commonly used bypass conduits in coronary bypass surgery and the most vulnerable to occlusive disease. Implantation of the vein graft into the arterial circulation causes immediate alterations in flow dynamics and wall tension. Shear stress-induced remodeling leads to acute dilatation of the vein graft in the first months post-implantation. High wall tension coupled with a non-laminar flow pattern accelerates the progression of pathological wall thickening, intimal hyperplasia. In the long term, intimal hyperplasia renders the vein graft lumen vulnerable to atherosclerosis, leading to vein graft stenosis and occlusion. Around 25% of vein grafts occlude over the first year after surgery. 5 years after bypass surgery, 40% of vein grafts are occluded, and as many as 50% of patent vein grafts are severely diseased. VEST is a novel external scaffold which targets the underlying mechanism of SVG intimal hyperplasia and failure. It alleviates SVG's wall tension and improves its lumen uniformity and flow pattern. VEST creates a hybrid bypass conduit which combines the benefits of both arterial and venous grafts. VEST is a kink-resistant cobalt chrome braid. Implantation of the device does not interfere with the routine grafting technique and requires only minutes to complete. After completion of the distal anastomosis, measure accurately the vein graft's length and assess its diameter using the VGS selection tool. Choose the VEST model according to the SVG dimensions and identify the distal and the proximal edges. Thread VEST over the vein graft using the VGS olive cannula. Expand VEST by milking or squeezing it gently against the SVG to cover about 80% of the vessel length, starting from the distal anastomosis towards the proximal top end. Complete the proximal anastomosis. Adjust the proximal end of VEST to its final position. By restraining the vein graft's wall tension and improving its lumen uniformity and flow pattern, VEST mitigates the vein graft's intimal hyperplasia and increases its longevity. The novel hybrid conduit combines the benefits of both arterial and venous grafts, a high-flow, versatile conduit which is insensitive to competitive flow and has high resistance to the development of accelerated atherosclerosis.